As a medical student, I really was drawn to pediatrics in general because of the opportunities to really work with young lives and help improve and save those young lives. So really, my interest in infectious disease springs from that because of the potential of helping young children. You're going to be able to have an impact not only on individual lives, but on many lives in terms of your research. So that was really inspiring to me, the idea that we could really chip away at childhood deaths around the world. I just love viruses. It's something that I learned in undergraduate at UCLA when I started taking classes in bacteriology, immunology, and virology. And I just thought viruses were fascinating and loved working with them. And the thought of being able to develop and work with viral vaccines was really fascinating to me. But I think one of the things that the Pediatric Infectious Disease Society does, and pediatricians in general, I think we're much more aware of mentorship of junior people. It really is important to have somebody help you develop your career, help you understand what it is you might want to try now, what that means for your career. And I think we have a lot of people in our field who really do a good job at that. People with diverse attitudes and diverse backgrounds bring new and exciting ideas to the table. And I think it does not only bring in that great talent, but we also serve communities in a more culturally comfortable way when we start to work with people who look like members of the community, when our physicians and our other healthcare professionals also start to reflect the face of the communities that we serve. And I find that that's true when I talk to my undergraduate advisees here who are people of color. When you really sit down to listen to their stories, it's fascinating to hear what they've been able to go through to get to where they are. When we want our trainees to develop research interests, we really try to build out sources of funding and ways to help them write their grants and giving them the tools that they need to start being able to support themselves. I don't think we're ever, unfortunately, going to be out of a job as infectious disease specialists. Infectious diseases are ever evolving, but with infectious diseases, you never know what might be coming around the corner, so we should be ready. But viruses continue to pose threats, and I think we need to be ready for them. For all of you trainees, I just see you as the future of our profession, and you will lead us into the next century and help us to prevent even more diseases in children.